back in the 1990s and before that, we had all these observational studies that told us that women did better than men as far as cardiovascular disease, and some of that information we've also come to realize was not accurate either. But it became the assumption that estrogens were protective. We knew that putting women on estrogens would result in a significant improvement in their lipid profile. HDL goes up, LDL goes down, and so there were lots of pretty convincing reasons, non-scientific but convincing reasons based on all these observational data, to assume that hormones were good for women. And you get into menopause, get on hormones. It will help prevent you from developing heart disease the way men without those hormones develop it. I remember really until the late 1990s, people would come into our offices and I would see a postmenopausal woman either with coronary disease or with some sort of vascular disease, or sometimes even just assumed to possibly have it. And it was almost a fist pounding on the table statement, you must talk to your doctor, you must get on replacement hormone therapy. And we made the assumptions that, well, they both have hearts and the hearts look alike on the autopsy table and in the cath lab, so it's a reasonable assumption that each gender would do exactly as well. That was wrong. Women, when they're having an MI, sometimes present with more atypical symptoms than men. And that's not to say that chest pain is not still the primary presenting symptom, because it is. And most women who come in with an MI come in with pretty typical symptoms. But there are some women, and much more in women than men, who will come in with fairly vague symptoms when they have their MI, in the absence of chest pain sometimes. Fatigue, shortness of breath, non-specific shortness of breath, things like that, that are easy for a physician to dismiss. The normals, what are regarded as acceptable norms for cholesterol, for example. The norm for a man is an HDL of at least 40. The norm for a woman is an HDL of at least 50. Part of the reason, or the main reason for that, is because the average woman has a higher HDL than a man to begin with, because of estrogen effect. The blood pressure, it turns out, is actually a more significant risk factor for the development of vascular disease in a woman, middle-aged or older woman, than it is in a man. It's a very important risk factor. Similarly, diabetes. A woman with diabetes, based on the diabetes, is at higher risk of overt vascular disease than a man. When the average woman who comes in with a first MI is older, they don't do as well with the first MI because of all of these things I'm about to go through. The average woman is older. The average woman who comes in with a first MI tends to have more complications already than the average man. Very often has poorer left ventricular function when they present. May have heart failure more often than when a man presents with an MI. And that's partially because of the fact that LV function is not as good, partially because the woman is older. And heart failure, the most significant risk factor for developing heart failure is advancing age. That's one of the reasons why, as we're allowing people to live longer, the incidence of heart failure is going up, because people are living longer. Women, when they come in with a first MI, as I said, are sicker for those reasons. They tend to come in later in the course of the MI than the man, and we talk about time is muscle. The earlier someone comes in after onset of their MI, the more we can do to salvage muscle that's being actively chewed up by the myocardial infarction. So the sooner the better. And the average woman tends to come in later than a man. Probably a lot of that is because of the impression that, well, women don't get heart disease or don't get heart disease as often as men do. Actually, another interesting statistic is that more women die of cardiovascular disease than men when we think of all cardiovascular diseases. And yet most people don't know that. In fact, most doctors don't recognize that fact.